Hello, welcome to Yoni community. From this video onwards, we are going to discuss the concept of Rogi Pariksha and its applied aspect. We will start with the Aptopadesha Pariksha. This video may go a little bit longer. When you think about the Aptopadesha Pariksha, it is being mentioned तत्रेदम् उपदिशन्ति बुद्धिमन्तः रोगम् एकैकम् एवं प्रकोपणम् एवं योनिम् एवम् उत्थानम् एवम् आत्मानम् एवम् अधिष्ठानम् एवं वेदनम् एवं संस्थानम् एवं शब्दस्पर्शरूपरसगन्धम् एवम् उपद्रवम् एवं वृद्धिस्थानक्षयसमन्वितम् एवम् उदर्कम् एवं नामानम् एवं योगं विद्या तस्मिन्नियं प्रतीकारार्थः प्रवृत्तिरथवा निवृत्तिरित्युपदेशात् ज्ञायते. When you split this particular shloka, Tatra idam upadishanti buddhimantaha. Tatra buddhimantaha idam upadishanti rogam eka ekam evam prakopanam evam yonim evam utthanam evam atmanam evam adhishthana evam vedanam evam samsthanam evam shabdasparsha ruparasagandham evam upadravam evam vruddhisthana kshaya samanvitam एवं उदर्कम एवं नामानम एवं योगम विद्यात् तस्मिन् नियम प्रतीकारार्थ प्रवृत्तिः अथवा निवृत्तिः इति उपदेशात् ज्ञायते. So this is about the splitting of this particular shloka. When you think about the prakopana, that is increase of ruksha, tva, etc. Ruksha guna, shita guna or laku guna, etc. When you think about the yoni, refers to the vatadi dosha increase in the body. Whether there may be a possibility of vata vriddhi or pitta vriddhi or kapha vriddhi or rajoguna vriddhi or tamo dosha vriddhi as such. When you think about the utthana, so here the term utthana, it is a nidana, it's a synonym of nidana. So that means whenever if you are seeing that any kind of the bahya nidana analysis, that is going to get described in this particular aspect. Atmana refers to the nature of the disease. Sannyasa, that is considered to be should be treated with emergency. And Adhishthana, which particular part that is being afflicted, whether is it Sharira or Manas. Or if it is Sharira, which part of the body, whether it is Asya or Udara or Uras or Shiras or even much more precisely Janusandhi or Gulpasandhi or Akshi or Shrotra or Asya. So in that way, we can able to localize the lesions as such, depending upon the presenting complaints. Regarding the Vedana, whether it is due to Vata Pradhanata or whether is it due to Pitta or Kapha, that means Toda specifically indicates Vata dominance or Daha indicates Pitta dominance, Kandu indicates Kapha dominance. In that way, depending upon the nature of discomfort, we are going to predict the possible, the dosha afflicted, etc. Samsthana, this is related to the clinical feature. So here it is being mentioned, Dravamala Pravritti, Budena Atidravamala Pravritti Atisaraha. That is helpful in the diagnosis of a Atisara. Prakarshena Prachuram Varam Varam Mutratyagam Garuti Esmin Roge Sapramehaha. So that means the frequent micturation is pathognomonic of a prameha. So like that. Shabda Sparsha Ruparasagandha. So that means regarding the person who is suffering from Sandhigata Vata, the person will be having the cracking sound in the affected joint. As such, the person is suffering from Vata Pradhana Kushta. He will be having the rough texture of the skin. Rupa, in the sense the person is suffering from Gridrasi, he will be having the gait of a vulture. So Rasa, as such, so that is specifically inferred. Suppose if the person is having the, what do you say, that the sore belching. So that means the person is having the Pitta dominance. In that way, the prediction may be done there. Or when you think about the appearance of the ants after micturation, indicates that the person is suffering from the prameha as such. And gandha, specific smell. For example, the person is suffering from what is that fruity odor, that is indicative of a ketoacidosis. So like that, so Upadrava, that refers to the complication. So that means there are certain criteria to decide the Upadrava. So that is we are going to discuss in the coming slides. And regarding the Vriddhisthana kshaya samanvita, Vriddhisthana kshaya samanvita in the sense the Vriddha, sthana or kshaya of dosha, dhatu or mala. As far as Udarka, that is considered to be Uttarakalina phala. That means sequel of a particular illness as such. As far as the name as such, name of the disease. So specific, for example, person is suffering from the, what do you say, that the grahani, specific name of the disease where the person will be having the typical lakshana, that is Agnimandya, etc., that will be present there. Yoga, that means the medications being used. So that means the what kind of medications are being specifically indicated. That is indicative of certain diagnosis as such. And pravritti in the sense that what are the do's. That means the person is suffering from the pitta pradhana vikara. It is being specifically suggested that the person has to take either the kshaya rasa or tikta or madhura rasa as such. Whereas don'ts in the sense the nivritti, in the sense the person is katu, amla and lavana. They are specifically being avoided in cases of specifically pitta dominant diseases. So like that, this is about the overall description. Now we are going to look into the each and every point in a little bit elaborate manner. When you think about the prakopana, so here we are going to see the increase of the guna itself, whether it is ruksha guna or laku guna or shita guna, etc. So that means vata dosha is being said to be having ruksha, shita, laghu, khara, sukshma, chala, etc. So these are the different qualities for vata dosha. As far as pitta dosha is concerned, snigdhata, ushnata, tikshnata, laghuta, visra, sara and dravata will be present. As far as kapha is concerned, snigdha, shita, guru, manda, shlakshna, mritsna, stira. These are the different qualities of a kapha dosha. When you think about the application, so when you think about the consumption of prathuka, this is responsible for the increase of ruksha guna in the body. So this particular ruksha guna may increase in the alimentary canal. This particular ruksha guna may increase in the intravascular compartment or interstitial compartment or intracellular compartment also. When you think about the increase of the ruksha guna in the intravascular compartment, so that is actually responsible for the slow movement of what do you say that the in the food substances in the alimentary canal. Whereas if the ruksha guna is going to get increased in the intravascular compartment, that is responsible for the shrinkage of a intravascular compartment. If it is increasing in the interstitial or intracellular compartment, the secretions are going to get reduced in the interstitial as well as intracellular compartment. When a person is going to take more amount of the gobi Manchurian, this may increase in the tikshna guna, ushna guna, lagu guna, etc. Consumption of banana or kadali may lead to the increase of shita, snigdha, guru guna in the body. And awakening at night time will increase the ruksha guna in the body. So in this way, so we have to think about the prakopana aspect. Now, when you think about the different examples, so in the extreme left example, it is an image of banana, as we have discussed earlier, which may lead to the increase of guru, snigdha, shita guna in the body itself. When you think about the right image, this may lead to the increase of either pitta or kapha dosha as such, because it is usually having the amla sattva. As the Ashtanga Hridaya says, Tatradya Marutam Gnanti Traistikta Kapam Kashatikta Madhura Pittam Anyetu Kurvade. When you think about the Amla Rasattva, So that is responsible for the increase of pitta as well as kapha dosha in the body. As the Vajrabodhika constitution, the Amla Rasa is having the Prithvi and Agni Mahabhuta. When there is Agni Mahabhuta increase, that is responsible for the increase of Pitta, whereas Prithvi Mahabhuta increase, that may lead to the increase of a Kapha dosha in the body. When you think about this particular example, so this may lead to the increase of Tikshna Guna, Ushna Guna, etc. If the person is taking the food, that is rice, along with the spicy substances, this may lead to that. If the person is taking more amount of the shali with what do you say, that dadi itself, this may lead to the increase of kapha dosha, specifically in the alimentary canal only initially. When you think about this particular example, the person is having the exposure of shita guna to the all the parts of the body, that is skin will be afflicted here. So that means when you think about the exposure outcome, it is much more generalized when you compare the previous example of a food intake, which is restricted to only alimentary canal at that particular time period. When you think about this particular example, there may be a possibility of increase of Ushna Guna in the intracellular compartment initially. In this way, so the prakopana will be altered depending upon the nature of Nidana Sevana. When you think about the yoni, so it is being mentioned by Chakrapani, that is Vata. So that means the presence of Karsha, that is considered to be emaciation, which is suggestive of the increase of Vata dosha in the body. Burning sensation in the epigastric region, that is indicative of Pitta dosha increase in the body. Swelling in the knee joint, that is specifically suggestive of the abnormal vitiation of Kapha dosha in the body. Frequent anger, increase of Pitta dosha in the body. So like that, we can able to know about the dosha vitiation depending upon the presenting complaint itself. When you think about this particular example, so if this is being used in the oral cavity, naturally, so this is responsible for the affliction of alimentary canal itself. Suppose if the persons are specifically doing the occupation of selling these red chilies, definitely, so they are having the exposure of this, what do you say, that the substances, that is the dry substances, etc., powders, they are going to inhale through the nose. That means the respiratory passage that will be afflicted in this particular occasion. Depending upon the nature of the exposure, the person may develop the clinical presentation. Whereas the second image, that is indicative of doing the vyayama, and that too, they are doing the vyayama in terms of the bright sunlight. So that means there may be a possibility of the increase of the Ushna Guna in the body, which may in turn leads to the increase of Pitta. And as they are doing this particular excessive Vyayama, so there may be a possibility of increase of Chala Guna, which in turn responsible for the increase of Vata dosha in the body. In that way, the person may have dual dosha prakopa. Whereas in the third example, so he is doing the cycling, that too in the cold atmosphere. So that means, as such, we have said earlier, because of the cycling, as such, the person may have the increase of, what do you say, that the Vata dosha. As the person is doing the cycling, that too in the Shita Pradesha, that also is responsible for the increase of Vata dosha there. When you think about the further yoni, as such, depending upon the clinical features, we can able to predict the dosha dominance. Presence of sneezing may indicate Vata dominance. Presence of cough may indicate vata dominance. So, sputum, whitish as such, there may be a possibility of kapha dominance along with vata dominance. Yellowish colored sputum, pitta dominance as well as vata dominance. Reddish colored sputum, pitta dominance as well as vata dominance. But here the association of rakta will also be present. Chest pain on the either sides of the chest and cough, specifically indicative of vata dominance. Presence of fever, pitta dominance. Body ache, vata dominance. Chills and rigor, that is indicative of vata dominance. So like that, depending upon the nature of clinical presentation, even we can able to predict what might be the possible the dosha they are going to get afflicted there. When you think about the Utthana, as such we have discussed, they are nothing but the synonym of Nidana or Hetu. So here we need to know about the Bahya Nidana of Vata or Pitta or Kapha. You need to know about it. For example, Vyayamad, Apatarpanad, Prapatanad, Bhangat, Kshayat, Jagarat, Veganam च विधारणाद अतिशुचः इत्यादि अतित्रासतः रूक्षक्षोभकषायतिक्त कटुकैरेभिः प्रकोपं व्रजेत् वायुर्वारिधरागमे परिणिदेशान्यपरान्यः अपि च. This is indicative of the Bahya Nidana of Vata dosha. Katvam loshna vidahi tikshna lavana krodhopavasa tapasri samparkatilatasi तदिसुराशिक्तारनालादिभिः भुक्ते चरिते भोजने च श्रद्धि ग्रीष्मस्थिति प्राणिनां मध्याह्ने तथा अर्धरात्र समये पित्तं प्रकोपं व्रजे. पित्तदोष बाह्य कारण. गुरु मधुर साथ दिग्ध दुग्धेक्ष भक्ष्य द्रवदति दिन निद्रा उपसर्पिष प्रपूरैः तुहिन पतन काले श्लेष्मणः संप्रकोपः प्रभवति दिवसादौ भुक्तमात्रे वसन्ते. These are the bahya nidana of our kapha dosha. So that means whenever if a person is coming to you, we have to analyze these nidana. Whether the person is having any 1, 2 or 3 nidana may be related to 1 dosha or 2 dosha or all the 3 dosha are being present or not, that has to be analyzed. In this particular example, first image as such, we are going to take the same image, same examples. In this particular occasion, if the person is having the exposure of this, that is red chilli, we are going to say there may be a possibility of the Ushna and Tikshna Guna exposure. So that means the person may have the increase of Pitta dosha in the body. In the second example, as the person is exposed to the Vyayama, cycling as well as the Ushna or Atapa Sevana, there may be a possibility of dual dosha prakopa, that is the Vata as well as the Pitta dosha. Suppose if this particular cycling is more when you compare with that of the Atapa, there may be a possibility of Vata dosha increase than Pitta dosha. Suppose if the person is doing the this what is it Atapa Sevana more than cycling, there may be a possibility of Pitta dosha increase much more than Vata dosha. In the third example, we can say the cycling as such, that too in the cold atmosphere, there may be a possibility of Vata dosha increase, not Kapha dosha. So when you think about this, so this Shita Guna, that is going to have an exposure all over the body simultaneously. That's how the person will be having the stiffness as such will be observed. That is an indication of a Vata dosha, not a Kapha dosha as such. So here are some of the other examples. Consumption of ice creams may suggestive of the increase of Kapha dosha or Vata dosha. Consumption of dadhi, that may be responsible for the increase of Kapha dosha or Pitta dosha. Consumption of sweet substances, Kapha dosha prakopa itself. Entry of food substances into the respiratory passages may be suggestive of what you say that the pranava srota affliction. Entry of dust particles or smoke as such, that is again suggestive of the Vata dosha increase, that too pranava srota affliction can be noted. So like that, the Utthana as such, that will be helpful in determining the diagnosis of a disease as such. When you think about the atmanam, that is Atma Swabhavaha. So that means it is suggestive of the uh, nature of the disease. For example, the Rohini, it's a disease where there will be abnormal increase of Pitta dosha is being seen. That is why it is considered to be Daruna in nature. So that means the Roga Bala is more than Rogi Bala. When you think about the second example, that is Sannyasa, that is being considered to be a treatable, that too it has to be treated with emergency care. So this is about the Chakrapani reference as such. When you think about the Rohini, that is nothing but a blisters. They are going to be specifically seen in joint areas. Whenever if a person is having any kind of the blisters, that will be having the Agni Dagdha Vedana. So in that way, that has to be considered. When you think about the sannyasa, as we have discussed, it is considered to be comatose state. As such, that means we have to know about the exact cause of this particular comatose state. Maybe hypovolemia, or maybe hypoglycemia, or maybe head injury, etc., etc. Or maybe electrolyte imbalance may be present, so that has to be noted. When you think about the Visarpa, wherein the spectrum of the diseases can be considered, where there will be fast spreading nature of a dosha will be seen. So that means that has to be treated with emergency. So this is a nature of the Visarpa as such. When you think about the Amla Pitta, that is specifically seen in the Abhyantara Roga Marga or Koshta flexion. So that means, so where the person may have Pitkanta Daha or Tikta Amlodgara. So these are the different characters of the disease that can be helpful in diagnosis of a disease. So in this particular occasion, say the person is having extreme left side, it is a localized lesion. So that means when you think about that, that is having a, what do you say, that the curability of the disease will be comparatively easier. When you think about the extreme right image, where the person may have the widespread lesion, so that the person may have the more time to have a recovery from the illness when you compare with that of the left as such. Then regarding the Adhishthana, when you think about the Adhishthana, Chakrapani says, Shariram Avayava Manahacha. So that means affliction of the disease or site of the disease has to be known, whether it is physique or body, such as Jvara, Atisara, Grahani, etc. Or when you think about the Avayava, part of the body that can be afflicted, that is Sharanga or Uras or Prishtha or Shiras, etc. Even that can be localized, such as Akshi is being affected. Even much more localization, Krishna Mandala is affected. So in that way, so Avayava can be predicted. Regarding the Manas affliction, such as Vishada or Unmada, as such, that can be considered. It is being mentioned by the Charaka Samhita, Shariram Sattva Samdam Cha Vyadhinamashrayo Matah. So that is being mentioned by the Charaka regarding the Vyadhi Adhishthana as such. So here that has to be decoded in this particular manner. Let us say some more examples to know about this. Suppose if the person is taking this particular the food, there are three people are there. Person Y is going to take this particular substances up to one plate only. So suppose if this is considered to be having the Ushna Tikshna as such, then person A will be having the milder dosha vishesha. Person B having the 2 plates consumption, so that means there will be a possibility of moderate pitta dosha vitiation. Person C consuming the 3 plates, so then that is considered to be there will be a possibility of a vitiation of pitta to a maximum extent. And as the person is going to consume, the initial affliction will be, again, it's a Sharira. Among Sharira, initial affliction will be Koshta or Abhyantar Roga Marga. When you think about the whole Abhyantar Roga Marga, the affliction of mouth and esophagus will be comparatively minimum. When you think about the affliction of stomach, that is little bit maximum in time duration, as the exposure of this particular etiological factor will be to the maximum extent in case of the stomach itself. The second maximum extent will be mouth, and third maximum extent will be there in cases of esophagus. When you think about this particular food substances consumption as far as upper alimentary canal is concerned. In this particular example, first image, the person may have an exposure of one part of the body, that is finger, that will be having an affliction, cold water exposure. When you think about the second image, cold water exposure will be there to the maximum extent. So that means as far as the curability, incurability of the disease is concerned, first one is comparatively easier to cure, whereas second one may require much more intense line of treatment may be necessary. In this particular example, smaller part is being affected, that is smaller part of the twak is being affected, whereas in the other image, larger part of the twak is being affected. So that means smaller part is being affected, probably it may get it shortened time for complete recovery, whereas on the larger part affliction, that may take longer amount of time for the complete recovery from the illness. As far as Vedana is concerned, so we have to identify what type of the dosha affliction can be noted. For example, Todana, that means pricking type of pain, may suggest you of the increase of Vata dosha in the body. Vedana, that is tearing type of pain, as if scissor is being used, which is again indicative of Vata dosha vitiation. Daha, or burning sensation in the body, that may indicate the Pitta dosha vitiation. Amlodgara, sore erectation, may indicate Pitta dosha vitiation. Janashotha, that is swelling in the knee joint, may indicate Kapha dosha vitiation. Kandu, or itching, may indicate Kapha dosha vitiation. So like that, the Vedana, the description helps us in making the diagnosis as such. Suppose in this particular example, if the person is taking this particular food substance in excess, the person may develop bloating sensation. If that is the case, then we are going to say there may be a possibility of Vata dosha increase. If the second individual is having a presentation with a sore erectation, then we are going to say the Pitta dosha increase. In the third individual, he is having the both bloating sensation as well as the sore erectation. Then we are going to say Vata or Pitta dosha vitiation can be possible in that particular situation. Of course, for even multiple factors such as Prakriti of the individual, etc., counts a lot, and physical strength of the individual and environment of the individual where he is living, all these are coming into picture whenever if you are noting about the Vedana of the person. In this particular example, the Vedana will be the localized in the first image. That means the recovery may be faster. In the second image, the Vedana or discomfort may be widespread, which may require much more longer line of treatment there. In this particular example, Vedana will be having the localized area, whereas second image, the larger part where the Vedana will be widespread. That means the first image may require minimum line of treatment, or otherwise what we can say is Alpa dosha vitiation, whereas second image we are going to say Bahu dosha vitiation, which may require much intense line of treatment. As far as Samsthana is concerned, Samsthana refers to Lakshana. Samsthanam Vyanjanam Lingam Lakshanam Chinnam Akritihi. Samsthana is a Lakshana, or roop of the particular disease. There are certain examples that are being mentioned. Deha Santapa and Manas Santapa can be helpful in the diagnosis of Jvara. Alparaktaha, Alpamedas. Alparakta, less amount of the blood. Alpamedas, less amount of the fat tissue. Nissaraha, that is lack of nutrition. Shidhalendriyaha, poor functioning of Jnanendriya and Karmendriya. Vaivaranya, that is discoloration, maybe pallor or etc. etc. that is indicative of Pandu Roga. Tikta Amlodgara, that is the bitter or sour taste. And Hritkantadaha, burning sensation in the retrosternal region or throat region, helpful in the diagnosis of Mlapitta. Prabhuta and Abilamutrata, that is increased amount of micturition and the passage of turbid urine, indicative of the diagnosis of Prameha. Sparshana, that is Sarpana, that means the fast spreading nature of the dosha to different parts of the twak, etc., is indicative of Visarpa. Initial Lakshana, in case of Padangushta or Hasta Angushta, that is the great toe or thumb, may helpful in the diagnosis of Vatarakta. Dvivibhrama, that is unable to identify the what is good or what is bad. The helpful in the diagnosis of Unmada. Bibhatsa Cheshta, that is involuntary violent movements. Tamaha Praveshaha, that is considered to be the unconsciousness. And Smriti Abhagamaha, that is loss of memory, helpful in the diagnosis of Apasmara. When you think about the particular Samsthana, suppose if the person are taking this particular substances, then we are going to see the Lakshana specifically related to Koshta or Abhyantara Roga Marga or Amasya affliction can be noted, such as Ajirna or Chardi or Avipaka or Tikta, Amla, Udgara or Hritkantadaha, etc. can be observed. In this particular example, the person may have the numbness only in the area where the person is touching the cold water. Whereas in the second image, the person may have the coldness may be observed in the all over the body itself. Suppose if this particular cold water is entering into the nose or alimentary canal, even the person may have the symptoms related to respiratory passages, etc., or otherwise alimentary canal. Or if this particular cold water is being exposed into the eyes, the person may have burning sensation or itching in the eyes that can be developed. So like that, the Samsthana may helpful in determining the depending upon the Nidana as such. In this particular occasion, Samsthana is limited to the one particular part itself, that is in the back. Whereas on the right side, it is widespread lesion. That means the affliction of widespread, that is the most of the skin, almost 90% of the skin can be afflicted. So that means here only the 3 or 4% in the first image, 90% in the second image. So that means which is more, the pronounced one. Naturally, the one which is widespread, that is considered to be much more virulent, whereas only localized lesion which is having the mild virulence. As far as the Shabda Sparsha Rupa Rasa Gandha, in the sense that is cracking sound of the knee joint, that is specifically indicative of that the Sandhigata Mata or osteoarthritis or increased peristaltic sounds that can be in cases of that the Anaha or Atopa, or what we can say borborygmi, all they are being analyzed by the Shabda Indriya or Shrotrendriya by the clinician. Dry skin lesion in case of dry eczema, or Ushna Sparsha in case of Ujvara, that is specifically touch of the clinician. Vaivarnya in case of Pandu, that is discoloration, or otherwise Bhekavarna, that is yellowish discoloration of the frog of rainy season, or Hatapaksha in the sense they reduce the movement of one half of the body, one Paksha, as such in case of Pakshaghata. These are the diagnosis that can be done by Rupa as such or by the vision of the clinician. Appearance of ants in place of urination by the person, which may indicate the suffering of Madhumeha by the individual. This is the only area where Anumana Pramana or inference is being made depending upon the clinical presentation. Prakrita or Vaikrita Gandha, such as the person who is suffering from ammoniacal smell in the odor, may indicate the person may be having chronic constipation. Like that, we can able to utilize this Shabda Sparsha Rupa Rasagandha. When you think about the Upadrava, it is being mentioned that Upadravastu khalu rogattara kalajo rogashrayo roga eva स्थूलो अणुर्वा रोगात् पश्चाज्जायते संज्ञः तत्र प्रधानो व्याधिः व्याधेः गुणभूत उपद्रवः. That means upadrava, that is apradhana. In some occasions that is being mentioned there. So there are certain things that you need to remember whenever if you are making a upadrava diagnosis, then that has to have the relation with the primary srotas. That means if a person is suffering from annavaha sroto vikara, upadrava should be related to annavaha srotas. So that means there has to be either purusha srota subflexion or there may be a possibility of pranavaha srota subflexion, because mahasrotas is considered to be having conglomeration of three srotas: pranavaha srotas, annavaha srotas and purishavaha srotas. Suppose if the person is suffering from the knee joint pain, in the sense there, of course, there may be a possibility of asti srota subflexion, and asti is considered to be the srota mula for majjavaha srotas. So that means majja may be affected, and asti vahanam srotasa medo mulam jakhanam cha. So that means medas is considered to be a srota mula of asti vaha srotas. So that means as person is suffering from the knee joint pain or swelling, we may expect the affliction of Medavaha Srotas, Astivaha Srotas, and Majjavaha Srotas also. In this way, the Upadrava assessment has to be done. So, whenever a person is suffering from the illness as such, of course, Srotomula affliction may be possible in due course of time. That may be either sooner or later, depending upon the nature of the Nidana Sevana, depending upon the virulence of Nidana Sevana, depending upon the number of the pathogens or the nidana in cases of exposure as such. So that means Sandhi Vedana, where there may be a possibility of Astivasrota affliction, but there may be a possibility of association of Medavasrota affliction or Majjavasrota affliction also. So Stula and Anu Upadrava, that is categorized based on the Mrudu and Daruna Vikara. So that means the person is having the, what you say, that Anu Upadrava, in the sense the person may have an improvement if you give the treatment for primary disease. If the person is suffering from Stula Upadrava, then Stula Upadrava has to be treated first than the primary disease. In this way, the Upadrava may be helpful in the diagnosis itself. So Vriddhi sthana kshaya, in the sense we have to know about Vriddhi, sthana, that means normal functions, and kshaya of the dosha, dhatu and mala. When you think about the lakshana as such, when you think about Vata Vriddhi lakshana, Vriddhasti kurute nila karshakashnoshna kamitva kampanaha shakragrahan bala nidrendriya bhramshapalaba brahmadinata pitta vriddhi pita vrindmutra netratva kshatrid dahalpa nidratah pittam kafa vriddhi श्लेष्माग्नि सदन प्रचय कालस्य गौरवं स्वैत्य शैत्य शतांगत्वं श्वासकासाति निद्रता आतक्षय लक्षण लिंगम क्षीणे निलेंगस्य सादोल्पं भाषिदेहितं संज्ञा मोहसता श्लेष्म वृद्धिक्तामय संभवः पित्तवृद्धि लक्षण, that is पित्ते मंदो अनलशितं प्रभाहानिः कफक्षय कफे भ्रमः श्लेष्माशयानां शून्यत्वं हृद्रवः श्लतसन्दिता. And even you have to know about the vruddha sthana and kshaya lakshana of dhatu as well as mala, etc. So such as rasopishtasmavat raktam visarpapliha vidradhin kushtavatasra pittasra gulma pakushakamalah pengagnidasha sammohar tattvanyetra mutrata mamsam gandarbudha granthi gandorudar varditah कंठादिश्वदिमांसं च तद्दन्मेदस्तथाश्रमम् अल्पेऽपि चेशिते श्वासं स्विक्तनोदर्लम्बनम् अस्त्यद्यस्त्यदिदन्तांशमज्जानेत्राङ्गगौरवं पर्वसुस्फुलमूलानि कुर्यात् कृच्छ्राण्यरुंश्च अतिस्त्रीकामतां वृत्तं शुक्रं शुक्राश्मरीमपि कुक्षमाधमानमाटोपं गौरवं वेतनां शत्रुत् मुद्रं तमस्ति निस्तोदं कृते अप्यकृतसंज्ञतां स्वेदोति स्वेददौर्गन्ध्य कण्डूरेवं च रक्षयेत् रसेरोक्षं श्रमः शोषो ग्लानिशब्दाः सहिष्णुता रक्ते अम्ल शिशिर प्रीति शिराशिथिलवृक्षताः मंसि अक्षग्लानि गण्डस्विशुष्कता सन्निवेदनाः मेधसि स्वपनं कट्यः तीक्ष्णो वृद्धिकृशाङ्गता अस्नस्य सोदरतनं दन्तकेशनकादिषु अस्तना मज्जने सौशीर्ये भ्रमस्तिमिरदर्शनं शुक्रे चिरात् प्रसिच्येत शुक्रं शोणितमेव वा तदोत्यर्थं शनयोर्मेढ्रं धूमायतीव च पुरुषे वायुरन्त्राणि सशब्दवेष्टयन्निव कुक्षो भ्रमति यात्युक्तं हृत्पार्श्वपीडयन् वृषं मूत्रेऽल्पं मूत्रेयत्कृच्छ विवरणं शास्त्रमेव वा स्वेदेरोमच्युति स्तब्धरोमता स्विदनं त्वचः. This is about the Vriddhi, Sthana and Kshaya Lakshana. This has to be analyzed whenever if you are having an interaction with the patient or with the client who is coming to you either in your hospital or in your private clinic, etc. So in this particular occasion, there may be a possibility of a Sharirik affliction, there may be a possibility of Koshta affliction, there may be a possibility of Abhyantar Rogamarga affliction, there may be a possibility of Amashaya affliction. When you think about the composition, the person may have an abnormal increase of the Pitta dosha. Depending upon the quantity of the Nidana Sevana, the person may have milder increase of Pitta dosha, moderate increase of Pitta dosha, or severe increase of Pitta dosha may be possible. In this particular example, so in the initial image, the person may have an abnormal mild increase of Vata dosha there. Whereas in the second image, the person may have an severe increase of Vata dosha. In this particular occasion, the milder increase of the dosha is being present in the left-sided image, where small part is being affected, whereas the second image, we are going to see the specific increase of Vata dosha there, the two widespread area we are going to see. That means Vata Vriddhi, but we are going to see the Kapha Kshaya also in that particular situation. As far as Udarka is concerned, Uttarakarina Phalam. So that means if a person is having exposure, what will be the next event? What will be the next event? What will be the fourth event, fifth event, sixth event? In that way, we have to analyze. So that means as far as a person is having the exposure to any kind of the Nidana, second pathological event will be Upadrava, Udarka there. Third event will be an Udarka for second event itself. Fourth event, that will be an Udarka for third event. In that way, Udarka has to be analyzed. When you think about these are the different examples, such as Rajas Sevana. Initially, the person may have sneezing. This may be followed by cough. So this particular cough also, initially the person may have dry cough. Later, he will be having the productive sputum. In this way, the Udarka has to be analyzed. Wound healing. That may be possible by fibrosis of wounded region. So here, wound healing is the next step of, what do you say, that the wound progression as such. So this is an Udarka in that particular situation. Person is suffering from Pakshaghata. They may have Kevala Vata manifested Lakshana, such as development of contractures. That is an Udarka itself. Suppose if the person is having immobility, the person may develop bed sores in the lower back, which can be an Udarka itself. In both these occasions, they are considered to be Ahita Udarka. So that means they are considered to be producing the harmful effect in the body. Whereas the wound healing as such, that may be producing the, what do you say, that the non-harmful effect or otherwise good effect to the human body. So that is the Hita Udarka. In that way, we have to analyze. As far as Nama, that is naming of the disease. Kushnadi Upriti Kushtam. the one which is responsible for the discoloration or disfiguration of the body, kushta is being diagnosed. When the person is having Svedavarodha, that is absence of sweating, Santapa, that is burning sensation, Sarvanga Grahana, that is the stiffness all over the body parts, Jvara will be diagnosed. Budena Adidrava Mala Pravrittihi, excessive passage of unformed or liquid stools through the anus, Atisara is being diagnosed. Pakvamala Pravritti, that is proper formed stool. Sarojamala Pravritti, that is painful defecation. Putimala Pravritti, that is passage of pus mixed stools. Muhurbadhamala Pravritti, frequent passage of constipated stools. As such, Muhurdravamala Pravritti, frequent passage of the liquid stools. And that too, which is being present years together history, will be pathognomonic of Grahani Roga. Samshoshat Rasadinam, that is Samshoshana or dryness of all the dhatu, is helpful in the diagnosis of Shosha. Ketaki Dhuli Varna, that is yellowish white colored discoloration, is necessary in the diagnosis of Pandu. Sambhinna Kansi Swanabhilla Toshaha, that is the description of what you say that the production of sound, which is similar to the broken bronze vessel, is helpful in the diagnosis of what you say that Kasa. In this way, the clinical features as such will be helpful in the diagnosis. As such, Nama or naming of the disease will be helpful. Regarding the yoga, that is nothing but formulations. Such as if the person is having the drug history of Kamodugarasa, we are going to say the person is suffering from Pitta dominant disease. The person may have an Koshta affliction. The person may have Raktadhatu affliction. In that way, we can able to think of. Simhanada Gugulu, the prescription will be making us to make the diagnosis of what is say that previous diagnosis made might be Amavata. Kaishara Gugulu might suggest the person may suffer from Vata Shonita or Vata Rakta. Chitrakadivati, the person may have Grahani dosha, or otherwise the person may have Agnimandya or Ajirna. Nityananda Rasa, Shlepada, Shivagutika, Shatakshina as such. Sorbitrate 10 milligrams sublingually is helpful in the remission of the symptoms. Chest pain may suggest the person may have ischemic heart disease. In this way, the formulation used by the patient may helpful in the diagnosis. Pravritti, in the sense the do's. What are the do's as such that has to be noted there? It is being mentioned by Chakrapani. Yam pratikara pravrittihi, in the sense the person is suffering from jwara, langhana pachanadhyartha pravrittihi. That means every effort is being made to make that the person is having either langhana as well as pachana. So that means there are certain examples. If the person is suffering from amajirana, langhana has to be planned. If the person is doing the ratri jagarana, naturally the person has to do divaswapna. Of course, the divaswapna should be half the duration of a ratri jagarana. Langhana is considered to be ideally planned in case of alpadosha dominant diseases. Doshavasechana is ideally planned in case of bahudosha dominant diseases. Tamakashwasa in case of Vasanta Rutu. Vamana is being ideally planned depending upon the one's physical strength. And the person is suffering from Amavata, Alepa Chikitsa can be planned. So these are the proper Pravritti has to be planned so far as if we are planning to have the improvement in the situation. As far as nivritti refers to, it is the don'ts. Nivrittischa pratikarartha yatha navajvare divaswapnadau nivrittiriti mantavyam. So that means these are the things that has to be contraindicated. So navajvare divaswapna sthanabhyanganna maithunam krodha pravata vyayaman kshayam shivarjayet. These are the nivritti factors to be followed when you are making a diagnosis of Tarunajvara. So the textbook says Annayena Gurvannam Abhidatte. So that means Anna has to be avoided, should be Guru Anna. And further, Jatukaranena kshaya gurushna stigdhan nanabhyangan navajvare varjaye. These are the things that person is suffering from tarunajvara or navajvara that has to be avoided. The main purpose of this nivritti is highlighted by Sushruta. Sankshaipatah kriya yogo nidana parivarjanam. The main line of treatment is nidana parivarjana. Chikitsa sutra is nidana parivarjana. If you are doing the nidana parivarjana, then 50 or 60% of the cases, the improvement is certain up to 50 to 60% itself. In this way, the nivritti will be helpful in the diagnosis of the disease. When you think about the application of Aptopadesha, these are the following factors that has to be analyzed. Of course, this is not a final list. This is an initial list itself. If you are thinking frequently again and again, even much more important points can be added as far as application of Aptopadesha is concerned. Regarding the first and foremost aspect, regarding the Bahya Srotas, what kind of the Bahya Srotas is being affected as far as etiological factor is concerned, and to what extent this Bahya Srotas is being affected in terms of quantity. So that means, so whether it is the number of pathogens are less, which are entering into the oral cavity, or number of pathogens are more in the oral cavity, or pathogens are entering via mouth as well as nose. In that particular sense, the amount of the, what you say, that the affliction of the disease will be much more wider when you compare the minimum exposure as such. That means when the person is having exposure of, what you say, that the dust particles through the nose as well as through the mouth, both the occasions the person may have an affliction of a respiratory passages itself. Sometimes even the person may have an affliction of alimentary canal to a lesser extent. So like that, the exposure of etiological factor regarding the quantity, and regarding the quality, regarding the virulence. Suppose if the more virulent nidana is being exposed, the person may show severe lakshana. If less virulent nidana is being exposed, then the person may have the milder form of disease as such. When you think about the overall assessment of the nidana and bahya srotas, more than 95% of the cases, the person may have an exposure on oral cavity only, maybe in the form of either adhishthana, or in the form of viruddhashana, or in the form of samashana, or in the form of atyashana, or in the form of vishamashana. So like that, so 95% of the cases, oral cavity may be exposed. So that means they are considered to be Nija type of diseases. If the person is doing adhyashana of a specifically ruksha ahara, and he is doing the vyayama without doing appropriate rest, in this particular occasion, bahya srotas afflicted may be initially in the mouth, later in the nose as such. So that means in both the occasions, there may be a possibility of pranavaha srotas affliction, depending upon the Ayurveda fundamentals. So that means it is being mentioned that pranavahanam srotasam hridayam moolam mahasrotascha. In this way, mahasrotas may be afflicted. So when you think about the next point, we have to know about the exact abnormal functioning of dosha, dhatu or mala. Which particular part of the body is being having the abnormal functioning, whether is it in the koshta, or whether is it in the shaka, or whether is it in the marmasthi sandhi. In case of shaka, whether is it in the rasa, or rakta, or mamsa, or meda, or asti, or majja, or shukra. Further localization, is it present in the akshi, or is it present in the nasa, or is it present in the shrotra, or is it present in the manibhadra, manibandha sandhi, or is it present in the kulpa sandhi, etc. In this way, we have to analyze. And abnormal functioning in terms of guna, Whether is it Shita Guna is increased, or Laghu Guna is increased, or Ruksha Guna is increased, or Ushna Guna is increased, that has to be analyzed. And based on that, we have to analyze the abnormal functioning of body constituents by appropriate thorough pariksha of the individual. So, the take-home messages from today's discussion are: Aptopadesha Pariksha is one of the foundation among the Rogi Pariksha as per Ayurveda fundamentals. This is being specifically mentioned in Trividha Pariksha as well as Chaturvidha Pariksha. If you split this particular, the Aptopadesha Pariksha, Tatra idam upadishanti buddhimantaha, that is, Tatra buddhimantah idam upadishanti, Rogam eka ekam, evam prakopanam, evam yonim, evam Utthanam, evam atmanam, evam Adhishthana, evam Vedanam, evam Samsthanam, evam Shabdasparsha Ruparasagandham, evam Upadravam, evam Vriddhi kshaya samanvitam, evam Udarkam, evam namanam, evam yogam vidyat, tasmin iyam pratikara artha pravrittihi athava nivrittihi iti upadeshat jnayate. Charaka Vimana, 4th chapter, 6th shloka. So, when you analyze this particular Aptopadesha, it is helpful in predicting the actual accurate diagnosis of a disease, and prognosis of the disease can be done in a more predictable manner and in a more convincing manner also. So, that's all from today. Dear ANA community, what are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you would like to hear in the coming days? Mention in the comment box below, and spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.